So, hello everyone. I have to tell you that I flew in from Paris to San Francisco on Thursday, and there was a really long wait to get to the part where you get your suitcase. And I was so disappointed because when I got there, my suitcase was waiting for me. Now, why would I be disappointed? Maybe some people remember that one of the times that I spoke here previously, I didn't have my suitcase. It didn't come until I was just about ready to leave. And I was able to tell you that I'd come from Paris and that I was dressed from head to toe by the Stanford shopping center. So I am here to tell you about Europe in a very short time. And you may know that it's, depending on how you define Europe, it's either 500 or 700 million people. It's 27 countries, 30 countries. And so obviously we're only going to cover a few things. But the most important of what we are going to cover concerns people. And that's what Doctors 2.0 and You is about. As Larry Chu says, it's the Medicine X of Europe. So I hope that we'll see all of you there next time to prolong the experience. And you can see here that it's all about the mind and all the compartments that we have in our mind about healthcare, and bringing all of those people together to observe and discuss the positive and negative sides of the explosion of digital health. And so we will talk about social media, mobile apps, serious games, and connected objects, all from the point of view of our mission, which is to improve life for patients everywhere by bringing people together. So we will today speak only of Europe, although the conference is global. And I will bring you along into all these different cells in my mind, and we will of course start with the ePatients, some of whom are sitting in this room. This was our poster. We also have a poster session. So we've had 27 ePatient speakers at the conference. I see Lisa Bernstein over here, and I know Michael Sears must be watching, and other Marie Ennis as well, who spoke with us. And this is a shout out to Alan Thomas, who's watching from Wales. He's seated in the front, right up front in his chair. And this was a whole group of the speakers and participants, a selfie at the very last meeting in June. So I'm going to start with three ePatients that I have selected who spoke at this conference and tell you some of their findings. Catherine Cerizet from France is a breast cancer survivor, and she chose to write a very open, identified blog after many years of living with her survivorship. And I asked her to tell us what had been the most successful blog posts. And it's fascinating to think, she obviously writes in French, that these three very practical articles that she wrote about hormone replacement therapy, about pain, and about chemical therapy got the most views. It's a huge number of views for somebody writing in French. Here is a Canadian-Swiss person who is multilingual. She has had to start, or she felt that she had to start, two communities. One also for breast cancer survivors in the French-speaking part of Switzerland, and the other for her son who has Asperger's. So she started an autistic community and has found the benefits of all of this hard work to be extremely positive. My hat is off to Roberto and Francesca, who in Italy had a child born having a stroke. And through their online research, they discovered the importance of working with the child in a very positive way. It's called this mirror neuron technology, and they've created a website, a not-for-profit organization, and actually, thanks to this, have been found and will be in the United States on a research grant for the next few months. So an amazing couple. So those are some of the examples of the ePatients. As our name would suggest, we also have physician speakers, and here are three from Spain, Belgium, and the Netherlands. Dr. Gonzalo Mora, who is an orthopedist in Spain, who is a full-time orthopedist, in addition, has created a startup for the purpose of sharing quality images, including being HIPAA compliant, on his app called Insight Medi, which he presented to us. And here are some of the examples of how simple, he made it simple enough for fellow physicians to be able to use it very easily to share. I think it's been co-designed with physicians to share images worldwide. This amazing head of gastroenterology of a Belgian hospital in Antwerp, Luc Colmont, has become famous in Belgium. This means stop colon cancer. And he has developed all sorts of social media campaigns, including when Brad Pitt turned 50, he developed this Dear Brad Pitt letter that he sent all over the place, found himself on TV. He's now known in Belgium for doing this, and thousands of people who would not otherwise have had the proper diagnostic tests have done it. So an amazing Luc Colmont. And then this Dutch woman, who is the woman featured here, along with Homero Rivas, who came to speak from Stanford last year, and Raphael Grossman, whom you well know. She is both president of a simulation society. Simulation, as you know, enables surgeons to improve their technical gestures before they actually do the surgery to get it right the first time. And she also has developed an app that we'll be talking about in a minute as we speak about Hospitals 2.0. So Marlies is with the Amsterdam Medical Center, and then we'll see a Spanish example. So at the Amsterdam Medical Center, she came up with an idea that is free for the taking called the Hospitality app, which is so simple. It's about the fact that older patients, when they come to the hospital for the first time for admission, might find it a bit bewildering and not knowing where to go. And so this app enables the intern or resident or doctor who's going to meet them to find them, because it has the photo of the physician who's going to be waiting for them and the photo of the patient. And this won an award. It's a very simple idea that can reduce the stress of a patient entering a large hospital complex. We've spoken here before about the Children's Hospital in Barcelona, HSJD, because it is incredibly digitally oriented, a true 2.0 hospital with telemedicine and devices, mobile apps, and an extensive social media campaign with hundreds of thousands of likes on all of the channels that they're on. So a real model in this way. And this time I wanted to mention that they got involved in partnerships that involved the patients and a pharmaceutical company. So this is the whole idea as well, as you can see the similarity with MedX, the multi-stakeholders. So the cystic fibrosis team thought that it could be useful to engage young patients to make that respiratory therapy more fun. And they did this through a game that was supported by work with Novartis, which involves blowing so that there is a real physical part to it, but also fun online stuff to do for the child both in and out of the hospital. It's called Funny Friends, and it's through a multiple partnership between the hospital, the patient association, and pharma company Novartis, which brings us in a beautiful transition to Pharma 2.0, also a very active partner of our conference and active in Europe in digital. So here we have the fact that this is prevention. I think for most of the past 2 days we've been speaking about what happens when you're ill, but the best thing is to put off getting ill. And so at Novartis, they've developed this program that is anonymous for all people working in the company to be able to get various quantified self-tracking devices and mobile apps and have an online coach. They did this for the first time in 2014, and it was presented as a way that really was team building, and people felt better, and it was much more successful. It had more people signing up than they had originally thought that they would. And Sanofi, so both of those are European-based companies, has a product that I believe is available worldwide to prevent surgery adherence. And they thought that they could attract surgeons using the Kinect from Microsoft. So they developed a special game on this tool, and that has been very successfully used in events and other exhibit areas. So that was another exciting, I would call it, multi-stakeholder project, again for the purpose of simulation, making things go better for the patient through the physician or surgeon being better prepared. And then each year we have a startup contest, and this year Larry Chu graciously accepted to chair that session. And so we had 7 companies from from different countries, from 5 different countries participating. And I'm going to go through some of them. So here is our photo right before that session where we were worried who's going to win. It was a tight call because there were such quality companies. So there was a French company that provides, in various languages, a quantified self dashboard that, as you may well hear, how many of you do quantified self-tracking? So you find yourself with a lot of different devices, and this is a dashboard to bring them all together in one stop for you. E-cigarettes, I know that they're debated with their pluses and minuses. We did have a French company that was presenting a new, better designed e-cigarette. And Asperity, which is a Belgian company introducing multilingual patient communities to connect with other cancer patients. There are many such approaches in Europe. An exciting German company providing second opinion services, which is something that can be so useful when you're considering a major procedure or a major engagement with a physician. And sitting here right in front of me is the founder, Tal Givoli, of MedAdvisor. You can see him there receiving first place. And so I guess I've given it away that he's going to be speaking later today to tell us all about MedAdvisor. So I won't say more because it's a great tool, and I'm going to let the founder talk about it. We also did in Europe something that was done for the first time, the iHealth Challenge, where every participant in the conference got a tracker and their names were projected onto the wall so that there was a bit of emulation. And we had actually a patient came in second position. She had spent all of the lunch hour and all of the breaks running in her ballerina shoes to take second place. So the iHealth Challenge was also a great success, demonstrating the arrival of quantified self. That was the first year that we felt it was important enough for us to talk about it. And we are the most tweeted medical conference outside of the US, and this is verified by our partnership as well with our friends Tom and Odin from Simpler, who are here. And I must say that we had some very interesting results from that, which was that our first tweeter was a physician in South Carolina who was not present with us, and we've seen her, that's next up one, we've seen her during these few days also be very much online. And at the moment that we had taken this view, it was Alan Thomas in Wales, but who was present with us, who had done the most tweets during the conference, and who's an incredible supporter of ours. We had 4 of the top 10 tweeters at the conference were patients who were present and very excited about and very participatory in the conference. And so now that you've seen the wheels turning at Doctors 2.0 and you, I hope that you will be interested in talking with me later on today, and knowing that we will never do anything regarding the patients without the patients. We're very much a co-constructed conference, but that we feel it's so important to have everybody, that's why it's the and you. So it's a conference for all of the stakeholders, and we really look forward to discussing with you online all year long and at our next event. Thank you very much.